Go. A little time-lapse photography.
Oh,
looks
very
pretty
nice.
sharp.
Yeah, it's beautiful here.
Live again from APTA CSM here at Anaheim, California. I want to say thanks to Empower EMR. If your clinic is stuck in an EMR that slows you down, that's your fault. You did that. You can also undo that. Empower EMR gives you speed, clean workflows, and features PTs actually ask for. Upgrade your clinic's brain with Empower EMR at empoweremr.com. That is empoweremr.com. If you've ever been told to look more professional without anyone defining what that actually means, this conversation is for you. I'm looking at you. Our next guest has spent her career expanding access to care and challenging narrow definitions of who gets to belong in this profession and who doesn't. Live for Anaheim, Jenn Bell, welcome to the show.
Yeah, thanks for having me.
Thanks for taking time here during the, it's a little busy. It's a little bit chaos. So it's a little bit of an unusual intro, right? Like, so how do most PTs define professional, and where's that fall short?
Yeah, definitely. Well, I think a lot of the definition of professional demeanor, professional appearance comes from kind of the classic white male heteronormative perspective that kind of governed health professions forever. And so that's the definition that's been handed down to us from other healthcare professions that came before us, and it's the one that's stuck around. The problem with that is not who our patients are.
And the world's changing.
Yeah, that's not who we're actually have a mission to get more of into our profession. And it's not having to conform to those normatives around professional behavior and demeanor and appearance burns people out. And so these are three big problems in our profession right now. How do we connect with patients where they are to have good patient-centered care? How do we recruit and retain diverse people to enter our profession and help them to feel like they belong there? And then how do we prevent them from burning out?
Yeah.
It's huge.
The world changed not that long ago.
Right.
Having a tattoo was like,
yeah,
it was sacrilege.
Mm-hmm.
And now, I don't know if it's a 2 at a scale of 1 to 10, but sometimes people will react that way. Having a piercing anywhere but a standard location was sacrilege.
Oh, I worked at a job in rural Alaska, and like the email comes out with like reminder about the dress code. You're only supposed to have nail polish that's red or pink, and like all of these like just archaic definitions of like what's acceptable. And I'm like, who in the world decided
this?
Pink and red are okay, but like blue or orange isn't? Like, it's just absurd.
And you said that was in rural Alaska.
Yeah.
Like, I mean, I gotta be honest, when you're that far away from help, like the rules,
nobody cares.
Right. Like, what are we doing? What are we dictating here?
Yeah. But even as recently as this summer, I had a student tell me that someone told them, like, you're not going to go into the clinic with your tattoos showing, are you? And it's like, and the student was like,
how would you like me to do that?
Right. And it's like, that's not the world that we live in right now. And
yeah.
if we continue to maintain those narrow definitions, we're really going to run people away.
Right. You're going to miss treating people, and you're going to miss the people that treat those people.
Yeah, exactly. And that make us better as PTs.
Who gets marginalized most by traditional, I'll use air quotes, traditional professional norms? Who does it affect the most?
Yeah, certainly. Well, I mean, we're a profession that has a lot of women in it, and that's great. But I see some of the biggest impacts are in people of color, women of color that are coming in, and then also our gender nonconforming members of our profession. They're the ones that are, how they show up isn't always appreciated or respected, right? And so, I don't want my students when they're graduating to have to worry about whether or not they should put their pronouns on their CV. It's like, if it's important to you, you need to put it on your CV, right? And you don't want to work for someone who isn't going to respect that.
Right.
So really thinking about the underrepresented people in our profession are the ones that are getting impacted by these older, more traditional norms.
Sure. Yeah. Why does this matter now?
Well, we're doing so much stuff to try to diversify the profession and recruit people in, but we have to accept them when they're here as they are. And then we have this huge burnout issue. And so when we're constantly telling people that you need to code switch in the workplace, that you need to not show up as your authentic self, you need to dress up to look like what we expect a PT to look like, that's adding additional cognitive
layers
load.
And barriers and all those things.
Exactly. And so, of course, those people are going to burn out faster because they're not able to fully relax as their true selves in the workplace.
What do students understand about authenticity, which is a word I don't think was used? It's being used a lot more now, especially when you can generate anything you want with artificial intelligence. But what do students understand about authenticity that maybe the profession forgot?
Yeah, I think the most of the students coming through are those younger generations. We have some non-traditional students coming through, but they see that they can show up in these diverse ways and be respected. They're seeing, people on social media that are medical professionals, that are leaders, that aren't conforming to the white male heteronormative expectations. And so they're seeing it. They're coming in and they're expecting us to welcome them in that way. And we really only have ourselves that are going to hold them back, right? And so we've got to open our eyes. We need to do some self-reflection. We need to stop and pause and think about, what is it, as for me as a white woman, what are my biases that I hold? I need to figure out what they are, check them, think about how I might be interacting with young people coming in, how am I connecting with my patients, to be able to really open up and allow these diverse individuals to really fully be themselves in our profession.
All right. You got a magic wand.
Yeah.
Which belief do PTs need to let go of first? And you get to decide, and no pressure.
No pressure.
Because no matter what you say, you're going to pick the wrong one to someone. But what do you think? What do you think they need to let go of first? Us, we could own it.
Yeah. No, I think we need to let go of our expectations that, a couple things. Our expectations that PTs are always going to continue to look the same way. I'm sorry, but we've put a lot of our khakis and polos and sneakers away.
We can ban that, right?
Yeah, for sure. Sorry to my friend Anna, who has it on right now. And we need to set aside the expectation that, well, I had to do it this way, so you have to do it this way. Like, luckily, these younger generations are coming in, and I'm 44, so I'm not that old, but I am that old. They're coming in with different expectations of what the workplace means to them, how they show up for their patients and connect. And we have a ton to learn. So we need to let go of our old expectations and learn through reflection, of being curious with people that are coming in that are different than us, so that we can all make the profession better and for our patients to get better faster.
Yeah. All right. We got a tradition on the show. It's called the parting shot.
Yeah.
What's the last, we're doing fast episodes here, but what's the last idea you'd want to leave with the audience, your mic drop moment or your soapbox statement? What do you got?
I think it's really important that we're continuously growing and changing as professionals, and that can include the way you look, the way you talk, the way you dress, and there's true value in showing up authentically for our colleagues and for our patients.
We're going to be better for it.
Yes.
Right?
Absolutely.
Yeah.
We're going to be better.
I mean,
we're going to be better people just in general, but also better PTs and leaders. And absolutely.
DE&I is, 3 letters that I don't know if they were talked about that much 10 years ago. And when someone's against that, I guess someone said it way better than me. They're like, so you're okay with the opposite of DE&I, which is, the opposite of diverse is homogenous, right? Equitable, inequitable, right? Diversity, equity, inclusion. You like exclusion? And if anybody, when you put it like that, it sounds not great.
No. And we've got to go that step beyond that to belonging, right?
So to not just make it right, to not just,
not just, bring these folks into the profession, but to help them to develop that sense that they belong in the profession, in the clinic with us, with their patients, and also making sure our patients feel like they belong with us and that we can relate and connect with them.
Exactly. Jenn Bell, where can people find you? Where would you send people to?
Yeah, so my Instagram handle is JennBell427, and I am a professor at Tufts University, so you can find me on the Tufts University DBT Phoenix website.
Jenn Bell, appreciate you stopping by here at the live stream at CSM.